So, this is our final lecture of the course, and it's a good time to pause, step back, and look at the bigger picture. You've spent the last few weeks learning how to show up with empathy, how to ask meaningful questions, how to track client themes, how to choose interventions, how to actually build real relationships, not just a set of techniques. But here's the thing, none of those skills matter if you don't know when they're working or when they're not. So, let me ask you this: how do you know when counseling is working? And maybe more importantly, how do you know when it's time to stop? This lecture pulls together everything that we've been learning. We're going to talk about how to evaluate your client's progress in a way that's useful and ethical, how to recognize when it's time to end therapy, and how to do it well, and how to reflect on yourself as a developing counselor, and how supervision, both now and later in your career, helps you become the kind of helper that you actually want to be. If the beginning of this course was about learning the art of helping, then this last part is about learning how to end well, grow from it, and carry what you've learned into whatever comes next. So let's start with the obvious but often overlooked question: are we even helping? And I don't mean that in a self-doubting way, though let's be honest, the question will show up sometimes. I mean it in a clinical, ethical, and strategic way. As counselors, we're responsible for tracking change, not just showing up and hoping something sticks, but actually checking in on whether what we're doing is helping the client move towards their goals. So we're going to look at outcome evaluation. And outcome evaluation just means assessing whether counseling is effective, whether clients are getting better. And there are two angles here: internal reasons. You want to make sure that your interventions are working. You want to grow as a counselor. And then there's also the external reasons. Agencies, insurance companies, supervisors, and clients themselves want or need clear evidence that progress is happening. And the point isn't to reduce counseling to a number, it's to stay honest and intentional. Evaluation keeps us grounded and helps us adjust when needed. So you've heard of evidence-based practice, right? Practice-based evidence flips the script. It says your counseling work becomes stronger when you're regularly gathering feedback and adapting based on what's working in real life. So it's not about being perfect, it's about being responsive. And there's some ways to evaluate outcomes that your textbook identifies in chapter 12. And here's some simple but powerful tools that you can use. And the first being client self-report. So you're going to ask the client how they're feeling. What's changed? What still feels stuck? Open dialogue really matters here. You're also going to want to look at using scaling questions, like on a scale of 1 to 10, how much anxiety are you feeling this week? Or where are you at today compared to where you were when we started? We can also look at using standardized measures like tools like the Beck Depression Inventory, the PHQ-9, the GAD-7. These will all give you structured data over time. We can also elicit feedback from others. So with client consent, you might talk to family, teachers, probation officers to gather other external stakeholder perspectives about how your client is doing. You can also look at goal attainment scaling. You and your client will set specific goals and track progress towards them. For example, client will practice one coping strategy per week for managing panic symptoms. This often looks a lot like a treatment plan. The final idea here is a client satisfaction form, and these can be formal surveys or informal check-ins. You want to know, do they feel heard, supported, or like they're growing? So let's pause for a moment and do a little thought experiment. I'm going to walk you through 3 short client examples. You'll choose one that stands out to you, and then you'll ask yourself a few questions, the kinds of questions that you'll be asking yourself all the time when you're working as a counselor. So when I'm done explaining the scenarios and the questions, I want you just to pause the video, give yourself a few minutes to reflect or jot some notes. Once you've made your decisions, hit play again and we'll keep going. So the first client scenario has to do with anxiety and sleep issues. So Taylor's 28. They report racing thoughts, constant worry, and trouble falling asleep. They just started a high pressure job and feel overwhelmed by the demands. Second client has to do with relationship conflict and depression. So Jordan's 40. They're in constant conflict with their partner, have been feeling withdrawn, down, unmotivated. They've missed work and are losing interest in things that they used to enjoy. And this third client is looking at trauma and avoidance. Allie's 19. They're in college and they have a trauma history. They avoid certain parts of campus, feel detached in social settings, and experience panic when places are crowded. So pick one of those 3, or maybe all 3, and we want to reflect on these questions. The first one being, what would you want to measure in this case? Think about symptoms, behavior, mood, relationships, functioning, whatever would show you that therapy is helping. And once you've identified the what, you want to look at the how. How do we measure that? Would you use a 1 to 10 scale, a formal assessment, a journaling prompt? Would you just talk about it openly? It might be different for each client. And the third question is, when would you check in? Every session? At the midpoint? How would you know when you're at the midpoint? Maybe after a major change? So go ahead and pause the video here, choose a client, think about your responses. When you're ready, hit play and we'll keep going. So the idea here is when we don't evaluate, we drift. We stay in sessions longer than needed, or we miss the fact that something isn't working. But when do we evaluate? We stay responsive, we stay ethical, we give our clients the best chance at real lasting change. And so the idea here is transparency and intentionality. We want to talk to each of our clients about what we're measuring, how we're measuring, and when we're measuring, and elicit feedback from them too. Does this make sense to them? Are we on the right track? Do they want to look at something else at a different timeline in a different way? We're going to meet them where they're at and adjust as needed. So the next part here is knowing when to terminate. When are we actually done with therapy? Ending therapy isn't just about wrapping things up. It's an ethical and clinical decision. And it's one that needs to be made with just as much care as starting therapy in the first place. So there's 5 questions that you can ask yourself when considering when it's time to terminate. And this is adapted from Young's framework in your textbook. The first question is the presenting problem under control? Has the core issue that they came in for improved? Second is, has the client developed effective coping? Can they handle stress, emotion, or conflict more effectively? Are relationships improved? Are they communicating better, setting boundaries? Does the client report better life satisfaction? Are they enjoying things more, engaging with life? And does the client feel capable without you? This is a really big one. Do they believe in their ability to manage on their own? You don't always need all 5 to be yes, but these are the kinds of things that you should be looking for when thinking about wrapping up and having conversations regularly about this with your client. I just want to talk about 3 common paths to termination. I believe Young only talks about 2, but in my observation, termination happens usually in one of 3 ways. And it's either from success, the client's met their goals, they've grown, they've built skills, maybe they healed something deep, they're ready to move on and they know it and you both feel it. The second one is referred to as stuckness or maybe misfit client. So sometimes progress stalls. Maybe they're not doing the work, skipping sessions, resisting feedback, staying in the same loop. Or maybe it becomes clear that the issue is beyond your scope, trauma work you're not trained for, or deeper personality concerns that need a different kind of approach. That's not failure, it's clinical judgment. Referring out is sometimes the most ethical caring move that you can make. And the third one is a little bit trickier to name, but I think it happens a lot, and that's just generally completion without resolution. Sometimes a client isn't done, but they've gotten as far as they can go with you. It's not success, it's not stuckness. It's just the natural end of the course of benefit in this particular relationship. Maybe they've outgrown your current scope of practice. Maybe they need a fresh perspective. Maybe they're ready for a modality that you don't use. Maybe the relationship itself has done its work and now something else is needed. This kind of ending takes honesty, humility, and trust in the ongoing process. It's not a failure, it's just a transition. And clinical work isn't always cleanly measured in goals met or not met. Sometimes the relationship serves its purpose and it's time for the client to take what they've gained and keep going somewhere new. So I want to give you a scenario and see what you do. So the scenario is that our client has failed to complete any homework assignments. They ruminate on the same issues session after session. They blame their spouse for everything. When you reflect strengths, they argue with you. And when you invite emotional exploration, they switch topics. So again, pause the video here and think through these next 3 questions. Jot down some thoughts if you want. First question is this client a candidate for termination? What's your gut say? And what would you need to know to be able to answer that? Second question is, what's your ethical responsibility here? What if they're not making progress but still showing up? Or what if they're not making progress but seemingly depending on the relationship? And the third question is, what supervision would you seek? What questions would you bring to your supervisor? How might your own countertransference be showing up? So pause here, take a moment, think about these answers, and then when you're ready, just hit play. Knowing when to end therapy and how to do it responsibly is one of the hardest parts of the work. It's easy to second guess, but with evaluation, supervision, and ethical grounding, you don't have to make that call alone. Sometimes therapy ends because things got better. Sometimes it ends because we've reached the limits of what this space can offer. Either way, ending well is part of helping well. So let's say you've done the work of evaluation. You've asked yourself the right questions, talked with your supervisor, and now you feel confident that your client is ready to end therapy or at least move towards that ending. So how do you actually do it? Not in theory, but actually in the room face to face. Termination is a phase, not one session. One of the most common mistakes new counselors make is thinking of termination as a single session, a final goodbye, maybe with some awkward encouragement tossed in at the end. But healthy termination is a process, not an event. You start preparing for it weeks in advance. Some say you start preparing for it the second that they come in to meet you for the first time. You check in, test the waters, revisit goals, talk through feelings, and plan for what comes next. When you're planning for termination from the beginning of the relationship, it's not a surprise to the client when it's time to end. So let's break this down into what you'll want to do during this phase. The first is normalizing feelings, both yours and theirs. Clients may feel proud, sad, scared, relieved, abandoned, maybe all of it. You might feel anxious about letting go, worried how they'll do, or unsure if you've done enough. These feelings are totally normal. Talk about them openly. Reflect what you're noticing. Invite the client to share their experience of ending. You could say something like, it sounds like part of you is excited about growth, and another part isn't sure what life will look like without the space, and that's okay. Let's make some room for that. The second is to highlight the client's strengths and actions. Make sure your client leaves with a clear sense of how they've made progress, not just how therapy helped, but that they made things happen. And you want to use reflective listening and review the journey. This is a great time to reflect big themes, identity shifts, or patterns that have emerged across your time together. You want to plan for relapse, setbacks, and future care. So endings can stir up fear. Clients worry that they'll lose their progress or won't know what to do if things get hard again. So talk about that and plan for it. And you also want to offer tools for maintenance. And here are just some ideas to discuss with your client. Choose what fits their style. You might offer some self-help groups like Alcoholics Anonymous or grief groups. Maybe offer journaling or letter writing to self, to you, to their past self, to their future self, role playing, or maybe even just scheduled check-ins to bolster sessions or a fade out plan. So ending therapy well is an act of care. It's not about disappearing or rushing out the door. It's about honoring the relationship and trusting the client to carry what they've learned forward, knowing that you've helped them to move towards something new. Now, let's shift the lens from your clients to you. Because while your job is to support somebody else's growth, counseling inevitably changes you too. Every client leaves a mark, some deeper than others. And in this section, I want to talk about what it means to reflect on your work, not just as a technician, but as a growing professional and a human being. So one of the best tools that we have for evaluating our growth is supervision. Supervision isn't just about making sure that you're doing things right. It's also a space for you to slow down, to unpack what's sticking with you, to notice your patterns, to name things that feel unresolved. And a good supervisor is going to offer two things: evaluation and support. And you're going to need both. We all do. So we can ask, what did this client teach you? Termination isn't just about the client's progress. It's a moment for you to pause and ask yourself, what did I learn from this process? What stuck with me about this client? Where did I feel confident in my skills? Where did I avoid something? Where did I overfunction? And what patterns in me are worth noticing? And these questions aren't about blame or shame. They're about becoming more aware of how you show up and how you want to keep growing. We also want to consider the emotional impact of termination. So let's not pretend that this part is clean and clinical. Sometimes ending with a client really hits hard, even when it's the right time. So you might feel grief over the loss of a meaningful connection, relief if the work has been heavy or draining, doubt, wondering if you did enough, and growth, seeing your own development and how you handled it. These reactions don't make you unprofessional, they make you human. And naming them in supervision, in writing, in reflection is how you stay present and grounded. So there are some tools that can help you make reflection a habit, not just something you do when a case ends. So weekly journaling. Try reflecting through the replan model like we talked about earlier in this semester. What goals did you target this week? What helped or didn't? Progress notes or DAP notes, SOAP notes, not just what the client said, but how you felt, what thoughts came up, what surprised you. When you're writing your notation for the session, this is a great time for you to pause and reflect on your own growth. You can also use peer consults. Even informal ones can offer new perspectives. And you want to consider feedback from your supervisor, both affirming and challenging. So I want to offer one last thought experiment here. So think back in a time in your life, maybe personal, maybe professional, where you had to say goodbye to someone or something, even though it was the right time. What came up for you? What made it hard? What helped you do it anyway? Now imagine how that kind of moment might show up for you as a counselor. Go ahead and pause the video here if you want, take a few minutes to reflect, journal if you'd like, and come back when you're ready. Becoming a counselor isn't just about learning techniques. It's about becoming somebody who can reflect, adjust, and keep growing, even when the work gets messy, uncertain, or emotional. Every client offers you something, not just in the work that you do, but in what you discover about yourself through the relationship. Your job is to pay attention and to stay curious about your own process, the same way that you do with your clients. So let's end where so much of your growth actually begins, in supervision. Supervision is where your skills take shape, where your blind spots get named, and where your confidence starts to catch up with your intention. It's where your growth as a counselor takes root. And eventually it's where your leadership will grow too. So we spent most of today talking about evaluation, reflection, and termination, all parts of being an effective and ethical counselor. But here's the truth. You can't do any of this well without supervision. Why? Because counselor self-evaluation doesn't happen in a vacuum. You can journal, reflect, and read all the right books, but you need another professional in the room with you. Someone who can see what you can't, challenge you when you're stuck, and help you track not just your client's growth, but your own. Because most of you will be supervisors someday. Whether you want it or not, this is part of the journey for most counselors. So learning about supervision now does two things. It teaches you what to look for in a good supervisor, and it helps give you a foundation for becoming one with integrity, humility, and care. Supervision isn't just about reviewing what happened in your sessions. It's about stepping back to see the whole picture of who you are as a helper. Bernard and Goodyear define supervision as an evaluative relationship that extends over time with the purpose of enhancing the professional functioning of the supervisee, monitoring the quality of services offered to the client, and serving as a gatekeeping function for the profession. So in many ways, supervision mirrors therapy itself. Think of it as a parallel process. Your client has you have a supervisor. Your client reflects on their life, you reflect on your clinical work. Your client is learning to trust, so are you. So I want to introduce two supervision models that can help you organize how you think about this work, because just like therapeutic models, there's also a ton of supervision models that exist that help your supervisor move through how to work with you and how to intervene. So the first being the discrimination model, and this is by Bernard, and it was developed in 1979, and it's really grown a lot since then. But this model describes three roles that your supervisor might take. The first being teacher, so that's going to offer structure, teaching skills, giving feedback. The next role is counselor, helping you explore your emotional reactions, transference, or blocks. And the third is the role of consultant, collaborating with you as a fellow professional, respecting your autonomy. And your supervisor is also going to focus on three areas. So there's intervention skills, what you're doing in session, conceptualization skills, how you understand your client and their story, and personalization skills, how your own identity, history, and emotions show up in the work. And so your supervisor, if they're working from this discrimination model, which just has a really unfortunate name, is going to kind of mix and match the roles and the areas that they're focusing on. So they might be a teacher teaching intervention skills, they might be a counselor looking at personalization skills, or they might be consulting on conceptualization skills. The next one I want to talk about is the Integrative Developmental Model, or the IDM, by Stoltenberg. And this model sees counselor growth as developmental, just like your clients. So level 1 or beginning counselors need a lot of structure and support. You might be unsure of yourself and rely heavily on direction. So think to practicum or maybe internship 1 or internship 2. Those are key times in your counseling life when you're going to be a level 1 counselor. In level 2, counselors start to question things. You're going to want more autonomy, but still crave reassurance. And in level 3, counselors are more confident, independent, looking for collaboration and growth on a deeper level. So here's a metaphor to try to remember it. It's like learning to ride a bike. At first, you need training wheels and somebody holding the seat. Later, you're steering on your own, but it still helps to check in about the route. And then when we talk about reflection and supervision, supervision isn't just technical, it's personal. We're going to be transformed as well. Clients can sometimes be our best teachers and supervisors, but this means that you grow not just from being taught, but from actually doing the work, from sitting with your client's story and then unpacking what it stirred in you with somebody who gets it. So take a moment to think about this. Again, maybe pause the video if it helps you, but how has supervision already shaped how you view your clients or how you view yourself? What do you fear about being evaluated? Can you imagine yourself supervising someone else someday? What would you want to do the same or differently from how you've been supervised? So just kind of summarizing supervision, your supervisor is the one who can help you decide when it's time to terminate and how to do it well, help you evaluate client outcomes and your own effectiveness, help you name what's emotionally heavy and sit with it, model what it looks like to hold boundaries, ethics, and care in the same hand. So much of how we show up with our clients is shaped by how we've been supported or not in supervision. And supervision is where counselors learn not just what to do, but who they are. It's where you get to ask the hard questions, admit what you don't know, and keep becoming the kind of therapist that you want to be. And eventually, it's how you shape the next generation too. So as we wrap up this final lecture of the course, I want to take a moment to say thank you. Thank you for the time that you've spent watching these lectures, for reading the material, reflecting, and showing up, not just to learn techniques, but to really become the kind of counselor who helps others change. Counseling is not something you do, it's something that you grow into. Here's what I hope that you remember from today. Evaluation gives us direction and accountability. It helps us stay grounded and honest about whether we're actually helping. Termination isn't a failure or a goodbye to fear. It's a part of ethical, effective care. And sometimes it's the most loving thing that we can do. Reflection is an extra. It's how we become better helpers. Self-awareness is not a luxury in this field. It's a responsibility. And supervision and mentorship will always matter. Whether you're just starting or 10 years in, the people you surround yourself with, those that you trust to guide you, challenge you, and support you will shape your growth more than any theory or technique. And I really love this book on being a therapist by Jeffrey Kotler. And Jeffrey reminds us that it's not the techniques or strategies that make the greatest difference. It's the presence, the authenticity, the willingness to join with clients in their pain, and the courage to stay there with them that matters the most. That presence, that courage, it's something that you cultivate every day through reflection, through feedback, through supervision, through practice. But you won't always know if you're doing it right. And if you stay open, if you stay curious, if you stay growing, you'll know when the work is real and your clients will feel it too. So before you go, I have one last question for you to reflect on. What might you need, internally or externally, to know that your work is done? Let that question stay with you, not just at the end of therapy, but at the end of sessions, semesters, jobs, seasons of life. It's one of the ways that you'll learn to trust yourself as a counselor. So wherever this path takes you next, to practicum, internship, or beyond, I hope you walk into those spaces with the same thoughtfulness and presence that you brought here. Thank you again for your work, your care, and your commitment. Be well and keep going.